Suicide is one of the leading causes of death, and unfortunately it's in a public health crisis because it has been on the rise. The suicide prevention movement has actually been fueled by the passion of loss survivors and people with lived experience. The toll is enormous, and including on clinicians. We are also human beings, and it's a 360-degree experience. It's not just through the clinical lens that we understand, suicide risk and prevention.
It was really started by a bunch of volunteers who were looking for a way to create community around survivorship and suicide loss. So in 1980, walks started, a way to gather community, a way to gather people, and it's grown to a community of over 2 million walkers. AFSP, the American Foundation for Suicide Prevention, our mission is to save lives and to give hope to those who've been affected by suicide. And we do that really in 4 big ways. We're the largest research organization here in the United States for suicide research. We advocate on behalf of suicide research. We educate individuals on suicide, mental health, and suicide research. And then lastly, loss and healing. So when we do these walks, we all gather together to support one another, to support those we've lost, and to support the community that we're building. We lost my wife in 2016 to suicide. It was the worst day in all of our lives. She was a wonderful light. And every time I walk like this, I think of her. And I look at the people around me and I know that I'm not walking by myself. There's all these people around that are helping and walking with us.
AFSP is so grateful for the relationship with Psych Congress. It helps to bring the word about suicide prevention out to both the general public as well as to clinicians. And the more we learn to talk about suicide and not have it be a secret, but an open conversation, the more we're going to be able to prevent suicide.
To all of my colleagues who are seeing patients and working so hard in the trenches, thank you so much for what you're doing. Please do not give up. Please take care of yourselves so that burnout and mental health distress doesn't get the best of you, so that you can continue to be the incredible resource to your patients. Thank you for continuing to learn about the latest strategies to prevent suicide. It's a partnership that we all have together.
Mental health care is essential in the effort to prevent suicide. So it helps us to bring the message out that suicide is something that can be prevented and that we all play a role in suicide prevention.